there's no notes around the room. And first things first, I'm going to walk in, check my orders, and then I'm going to wash my hands, and then I'm going to provide privacy, and then I'm going to greet the patients. Hi, I'm Candace. I'll be doing head to neck assessment.
Hi, I'm Trisha.
Nice.
How are you?
Good. How are you?
Pretty good.
That's good. Could you verify your name, please?
My name is Trisha Lyons.
Okay. She just verified her name, so that's the first identifier. And can you verify your date of birth?
May 20th, 1993.
All right. Thank you. And she just verified her second identifier, which is her date of birth. And now we're going to. What brings you in today?
I had really bad migraines lately. Like, I don't know. I don't know if the weather is changing or it's because, I don't know,
Okay.
that time of the month. I don't know. Like, it's just bad migraines I'm having lately.
Okay, so how long have you been having these migraines?
For about a week now.
When did it start?
Like, last Sunday.
Okay.
Yeah, right after church.
Okay. All right then. So what have you been taking for your migraines?
I took Tylenol and a little aspirin. I was told to, combine both pills. Maybe that could help. It's like just over the counter stuff, low dosage, but nothing just seems to work.
Okay. Do you feel like when you take the medication that you've been taking, do you think the pain is feel worse, or does it make you feel better?
It doesn't. I don't feel anything. Like, it just makes me sleepy.
Oh, so drowsy and stuff.
Yeah, it just makes me drowsy, but the pain is there. So, like, I'm just asleep.
Okay.
And I have to work, so that's not good.
Oh. How do you take like half of it when you have to work, or do you just not take it at all?
I usually have to take it because it gets so bad when I'm at work. I can't focus on working. And I have to work because I have a whole bunch of kids to take care of. My husband, he works too. And it's just a long story. We just have a lot we have to do. Like, I can't afford to miss work. I have to be at work.
Right. Oh, okay. Well, first thing we're gonna do, we're gonna test your obviously for first of all we're gonna test your overall appearance. So her overall appearance is very clean. Her hair is brushed, and her clothes is clean, and she's dressed appropriately for the fall. And so now moving on to the neuro. So I'm gonna ask you a couple questions. So do you know what today's date is?
Today is October the 7th, 2018.
Okay, and she just verified the date and the year. Do you know where you're at right now?
I'm in the dorm room.
Okay, and she just
which is technically the doctor's office.
Okay. All right then, and she just verified the place. Do you know who you are?
Yes.
What's your name?
Trisha Lyons.
Okay. And thank you. And she just verified who she is, the person. So her memory, her cognition and orientation is intact. And another question I'm going to ask you is, do you know how apples and bananas are alike?
How they're alike?
Yes.
Oh, they both have skin.
Yes.
And they both taste good.
Yes.
They're both fruit.
Okay. And so she just verified that they're both fruit, and so her cognitive orientation pertaining to the identification of fruit as well as intact. So now we're going to move on to the hair and skin. And so now I'm going to put on my gloves.
Yeah, thank you for washing your hands because it's like the fall season, so it's a lot of germs and stuff going around. So that really makes me feel comfortable that you washed your hands before you started to examine everything. That's pretty cool. Thank you so much.
You're welcome.
Yeah. Yeah, I had to come here and make an appointment to come in because I wasn't feeling too well.
Oh no.
Yeah.
Or has anything else occurred as far as like Any medical problems? Like, have you been having
No.
any headaches or?
No, and I don't really like prescription medicine, like
Mhm.
just because I just don't like taking it.
Mhm.
Sometimes it's too strong for me. That's why I usually take like over the counter medicine and not really prescribed.
Mhm.
So, I mean, if I have to take it, I will. But if you have something like another recommendation or like another, I don't know, some kind of something different that I could do, maybe that could help me also.
Okay. All right. So now we have the gloves on. I like to wear gloves when touching the patient's hair. And so we're going to um, just look through the hair, make sure there's no lesions. And we're not gonna I'm going to make sure you don't have any lesions, like any lice or anything. And so far the patient doesn't have any lice. And there's no sign like any alopecia or anything. And we're going and her skin, as for skin temperature, so her hair is the texture itself is very soft. And first, so after I do this hair, I'm going to take off the gloves, wash my hands, take off the gloves, wash my hands. I just took off the gloves. Um, and now we're going to look at the skin, and her skin is melanin, and she has a little bit of acne all over. Any pain anywhere? Any?
No, I went to a doctor also for that.
Okay. Did he prescribe anything or?
They gave me an antibiotic that I finished, and they also gave me antibacterial ointment.
Okay. Okay. And so she just have only findings that I see is that she has acne, but her skin is very is melanin and has a very the texture is where it should be, which is melanin. And so now we're going to go to the head. So we're gonna palpate the head. And do you feel any pain anywhere? Like where exactly is your pain in the right here?
Yeah, it's like the temple part.
Okay.
Ow.
So we're going to palpate the head.
Should I take off my glasses?
Yes, if that's more comfortable for you.
Okay.
All right.
Ow.
Okay, so it's gonna be so around the temple. The temporal artery is where she experiences tenderness. So we're done palpating this part of the head. So we're gonna palpate the back of the head. Any tenderness back there?
A little bit, not as much as the front.
How would you describe your pain?
Excuse me.
How would you describe your pain?
On a scale of 1 to 10, it's like a 4 or 5.
Okay.
The front looks like an 8 or a 7.
Okay.
A 7 or 8.
Okay. All right. So we palpated the head, and we are going to also look and see that her head is symmetrical, where it should be in line with her body.
Yeah, I don't have any strokes or I haven't had any strokes.
Okay. And so her body, her head is normal, and so now we're going to do the eyes. So we're going to check the eyes, and I'm going to use the first thing we're going to check is cranial nerve 2. So I'm going to use my pen light, and we are going to just use this light to focus. Oops, sorry. Is it really bright?
A migraine, a light kind of like mixes together.
Okay.
Yeah.
Yeah. So would it be better for you to put your glasses on, or would you?
No, let's just hurry up and get it over with.
Okay. So for cranial nerve 2, so we're gonna watch and see if the pupils constrict. And they are constricted. And so her pupils are intact. So cranial nerve 2 is intact because both eyes constricted with the pen light. And so now we're going to move on to the what I would call the Jaeger test. So therefore, you would cover one eye. So you would probably you'll cover the left eye. Would it be better with your glasses or?
I can keep them off.
Okay. All right. So I will hold up my fingers and you would tell me what you see.
I see 2.
Okay.
3.
All right. So she demonstrated that she saw the rumor test. The Jaeger test. So the cranial nerve 2 is intact as well for that one. So, and now we're gonna switch eyes. So you're gonna cover your right eye, and then we're going to do the same thing. So.
That's number 4.
Okay.
1.
All right. And they're both you can take it out of your hand now. And now, so I tested both eyes and they're both symmetrical and they both have 20/30 vision. And so now we're moving on to the Snellen test. So we're just gonna.
Can I put my glasses back on?
Yeah, you can.
Okay. They're a little dirty.
Okay.
So while you get that right, I'll just clean this up real quick.
All right. All right, so we're just going to pretend this is a Snellen chart. So I use the Snellen chart, and I would ask the patient what she sees. So can you read the first line right there?
It says, keep gauze on surgical area with firm, not hard pressure for 30 minutes after you leave.
Okay, now try it with your left eye. Like cover your left eye and try reading the same line.
It says, keep gauze on surgical area with firm, not hard pressure for 30 minutes after you leave.
All right, and try with your right eye.
It says, keep gauze on surgical area with firm, not hard pressure for 30 minutes after you leave.
All right, so cranial nerve 2, 4 is intact because she did read with 20/30 vision as well in both eyes, and there is no crossing of the eyes. And now we're going to do the 6 cardinal gaze, where I'm going to ask you to follow my pin light, and it's not going to be on, so you don't have to worry about that. So I'm going to move it in 6 different directions, and I'm going to watch if the eyes.
I think somebody's playing their car music really loud. I mean, I'm okay, but you know, with the migraine, it makes it kind of, difficult. No, they'll turn the music off pretty soon, so it's okay. We'll just continue. They'll turn the music down in their car pretty soon.
Yeah. Shoot. Okay. So we're going to, like I said, we're going to do the 6 cardinal gaze. And so I'm going to move this way. You're not going to move your head, just your eyes.
Okay.
So just follow the pin, okay? All right. And cranial nerve 2, 4, and 6 is intact. She did not show any signs of twitching, and there is tenderness. So now to check for the tenderness, we're gonna do I'm gonna lift up your frontal. So just tell me if you feel any tenderness right here.
Ow.
Okay, so when I lift up her frontal the frontal part of her eye, she feels tenderness there. So I'm going to do.
Ow.
You feel tenderness there too?
Yeah.
Okay. So for cranial nerve 3 and 4, she is intact, but she does feel tenderness when I do palpate it. And so now we're going to move on to cranial nerve number 8, which is the ears. And so we're going to shine.
Excuse me if my ears are a little dirty.
Okay. So we're going to shine light in her ear, and we're going to, her ears should be a pearly gray color on the inside, which they are. And then we're going to check the other side as well. And her right ear is a pearly gray like it should be. And so now we're going to palpate the ears. All right, we're going to palpate the pinna, and
Ow.
Does that hurt?
A little, yeah.
Okay, so she shows tenderness. Cranial 8 is intact for the part where I have to, I did the check her ears, but they are intact. They are symmetrical. Her ears are tender when I palpate. And so now to check the function of the ears, we're going to do a whisper test. So I'm going to say a couple words in each ear. So the first ear I'm going to test is the left ear. So I'm going to have you cover your right ear. Okay? All right. Here we go.
Want me to repeat it?
Yeah.
Pump kite. Is that what you said? Pump kite.
All right.
Pillow grass.
All right. And to demonstrate so cranial nerve 8 is intact because she did tell me the words that I did whisper in her ear. And so the whisper test did help. And so cranial 8 is intact. So now we're moving on to the mouth. And we're going to, and with my pen light, I'm going to do cranial nerve number 9. I'm going to do cranial number 9, so I'm going to have you say ah.
Ah.
All right, and I hate when talking. But I was saying you can't move your tongue because I have to see if you do it. Now I'm gonna have to do it all over again. Probably because they're still not. So the uvula is intact and in line as it should be. So cranial nerve 9 is intact, and 10. Could you swallow for me, please? Right, and she swallowed no problem. So cranial 10 is intact, and for cranial 12, I'm gonna have you say light, tight, dynamite.
Dynamite.
All right, and she said that with no problem. So cranial nerve 12 is intact. So now moving on to cranial nerve 5, and I'm going to feel for your temporal, and you said,
ow.
That is, so cranial nerve 5 is intact, so I'm going to press down and feel for any tenderness, and she said that cranial nerve 5 is intact, and so I'm going to push on your chin, and you're going to open your mouth, and you're going to try to resist. Alright, and she did the resistance just fine, so cranial nerve 5 is intact as well for that part of it. Now we're going to move on to cranial nerve 7. And so for this one, I'm going to have you move your, I'm going to put my hands, and you're going to try to turn. Okay? Alright? And I'm going to do the same thing on this side. And she did that with no, and she did that with no problem. So cranial nerve 7 is intact. And now we're going to do cranial nerve 11. Alright? So what I'm going to have you do is for cranial nerve 11, I'm going to ask her to shrug her shoulders. So you shrug your shoulders. Alright? And she did that with no problem. So cranial nerve 11 is intact. And so now I'll have you stand up. Alright? And so now we're going to do the gait test to test cranial nerve 11. So what I'm going to have you do is just walk forward and back. No, turn around. I meant like, yeah. Okay. Yeah, I'm probably have to start over.
Or not start over.
But then he's gonna notice I'm not together.
What else, nurse?
Okay. So we did that. So she demonstrated. So cranial nerve 11 with no problem. So cranial nerve 11 is intact. And now we're gonna do. So I'll have you sit down again. Right. So we're going to do the Babinski reflex, which I'm going to tap with my pin light.
Mm-hmm.
And you're gonna. So when I tap like this, your footman's gonna do that. So there we go. Yep. So her reflexes are normal, and so cranial nerve is intact as well, doing the Babinski test. And now we're gonna do the Romberg test. So I'm gonna have you stand up again. All right. And so I'm gonna have you close your eyes. And then you're gonna cross your arms or just stand straight, whatever's comfortable. All right, so close your eyes. All right, and so just start swaying like back and forth. Let's see, so we're checking your balance. Okay, so as demonstrated, her balance is everything is symmetrical, and and she's. Are you guys mentioned?
It was.
Oh, okay. Girl, I'm probably gonna fail this freaking video. And so 11 is intact as well, and her balance is normal, and you can uncross your arms out. And so now we're going to do the finger to nose. So I'm going to have you to close your eyes and then touch your finger.
Touch my nose, my finger.
Close your eyes at the same time. Yep. And do the other same. Yep. And so cranial nerve 11 is also intact because she was able to do that with no problem. And so now we're going to do the foot to shin test. So I'm going to have you sit down. And so you're going to try to raise your right foot over your left shin. Yep. And she did that with no problem. And we're going to do the same with the left. Yep. All right. And cranial nerve 11 is intact because she did that with no problems. And now we're going to do, now I'm going to, well, I need you to pull my hand, like pull. Yep. Pull. Now pull. Kind of take my finger. Now squeeze. And squeeze back. Alright? And she did that with no problem. And now we're going to do, you're going to push my hand. So you're going to push my hand down. Yep. And then try to push up. Okay. Alright? And she did, and her, that's it. Cranial nerve 11 is intact because she did that with no issues. And so now we're going to do your feet. So therefore, I'm going to push on your feet. So we're going to push down and then push up. Okay? And we're going to do the right leg. Push down, push up. All right. Thank you. And so we just did the push the pronation and supination, and she did that with no problem. So we're going to do circumduction, that's rolling arms. All right, flexion, extension. All right, so try those. So circumduction, she did circumduction, flexion, extension. Yep, and so she did those with no problem. So also everything that she did for cranial nerve 11 is intact. And so now we're on to the nose. So therefore the nose, I'm going to put my finger and you're going to try to sniff with one side. That's not, I'm covering this one, so you're gonna try to sniff. Yep. So for for her nose, um, it's it's very moist, patent, um, and there's no lesions or anything. And now we're gonna do the other side. So, all right, and as well as very moist, very there's no deviations in the nose. And so we're doing that, and now we're gonna do a smell test. So, um, oh, oh, hold on, what is? So you're gonna smell this, and you're gonna tell me what you smell.
It smells good.
Okay, what it smells like.
It smells, it smells like something. It's like perfume.
Okay, like flowers or food.
It smells like, it can smell like flowers. Yeah, it smells like a group of flowers, like roses.
Okay, so as demonstrated, I did the smell test and I used my perfume, and so she said that it smells like roses, like flowery. So cranial nerve one is intact, and also we're gonna go back into the mouth because we have to inspect if she has any cavities or any dental work. Which
I do.
so you do have any dental work? Type what type of dental?
I've had cavities, fillings, of course, with the cavities, um, root canals, and I've also had wisdom teeth pulled out.
Okay.
Yeah, so,
All right. Say ah.
um,
All right. So there's no cavities. And the hard palate, soft palate is indeed is soft and hard as it should be. Um, her tongue is nice and pink and it's moist. And so now we're going to look for on her pharyngeal wall. So I'm gonna have to say ah again. All right. So now we're gonna do this. Okay. All right. And there is no any dental work, or you said you have like what type of dental work?
yep, it was fillings. I've had root canals and wisdom teeth pulled.
Okay, so she had there were some dental work, so she had a root canal, her wisdom teeth pulled, and fillings. And so now we're going to do the gag. We're gonna check your gag reflex, and so we're gonna poke. Okay, well her gag reflex is good. Her gag reflex is good and is normal. And so now we've done that. So we're so Cranial 9, 10, and 12 is intact because I did check. She did say like type dynamite. So those were intact. And so now we're going to move over to the neck. And so we're going to sorry. So we're going to palpate the preocular.
Oh,
Is it tender?
a little.
Okay.
It's like going from my temple down to my neck.
Okay. So we're going to check and so she's noted there's tenderness where the preocular is located. And so we're going to do the postocular.
Oh.
Tender?
Mm-hmm.
Okay. So she noted that there's tenderness in the postocular as well. And now we're going to do the posterior. Oops, sorry. The posterior superficial posterior superficial clavicle.
Okay.
And so we're going to palpate there any tenderness there.
A little.
A little bit. So
it's like a 4.
A 4. Okay. So we did the palpation for the. She noted that there's some tenderness in the posterior superficial posterior ocular, and then we're going to move down to the superficial clavicle. And any tenderness there? Tenderness there? No. Okay. We're gonna move down to the deep cervical, no tenderness. Alright, we're gonna move down to, oh, I should start there. We're gonna,
Oh.
so I'm at the submandibular, and she said there's tenderness there, and I'm going to move over to the tonsillar,
Oh.
and and as demonstrated that there's tenderness in the tonsillar, and then we're going to move to the masseter. No tenderness there. There's no tenderness there, and we're going to do the, that's it. It was backwards. Then the submental, which is any tenderness there. Okay, and we're going to do the supraclavicle. Any tenderness there?
No.
Right. The deep clavicle chain. Any tenderness there?
No.
All right. And so we're going to. And I'm also going to ask her any vision, since we did the eyes, but you haven't had any vision loss, or like she did wear glasses, so. And so anything other, any health problems or?
No, but I'm starting to feel better since I'm here.
Okay.
I'm starting to feel better.
Oh my goodness. Okay. So and so that's the end of the video, and that's how you do a head to neck assessment. And this, thank you, Trisha, for volunteering. And so after I'm done, I'm going to chart my findings. I'm going to wash my hands. I'm going to make sure she has her slip socks on and her collet. And then I'm going to exit the room. So that's how you do a head to neck assessment. Thank you. I'm like, oh, okay. I'm like, bro,